morning, everybody. This is Ry Farram. I'm the Senior VP here at Regions Health Resources. I've got Amy Baker on the line with us. She's our data engineer. Welcome to the AHRA datalynx training session and demo. Thank everybody for joining us this morning. We're also going to be down at the annual conference in Orlando coming up this weekend, so would love it if anybody wants to stop by and say hello, and we can go through some of this in some more detail. I'm going to give you a quick introduction on sort of where we are, how we got here, and then hand some of this over to Amy. She and I are going to go back and forth a little bit and go through some of the demo process on taking the surveys, what datalynx is and what it looks like, how you guys can use it, and then we'll get into pricing at the end. We've got everybody's mics open, so if there are questions that come up or you guys have any comments, we welcome the feedback, so please speak up. If at any point somebody needs to, if a phone rings, needs to take a call, etc., we can try to mute individuals as needed, but if you have to step out and take a call, we certainly understand. Just remember that your mics are open, so we can pick up background noise if there is some. So from here, we're just going to go ahead and get started. How we got here, most of you, I'm sure, are familiar with the old survey process that AHRA went through, where surveys were sent out. It was done every couple of years, maybe every 3 years. Very manual process to enter in the data results, and then that was sent on to a survey company who would take all of that, combine it all together in their system, and then print out a book. And everybody was able to buy access to that book and just look at some of the various metrics, the percentiles, that sort of thing for the metrics that were being used. It was done basically for comp and benefits and productivity and utilization. Well, we started working with AHRA not quite a year ago, and started working with them and their data team about how best to approach getting metrics, benchmarks, and data accessible to all the members in a much more user-friendly interface. And so we've spent the better part of this year designing the datalynx tool, which we'll show you shortly, as well as the surveys themselves. And for all of you that have completed your surveys, which I'm sure is everybody on this call, you'll notice that we've also expanded the survey questionnaire. So there's more than just the productivity and utilization and the comp and benefits. It's been extended into radiologist information, referring information, financials, equipment, etc. We understand that they're comprehensive. There's a lot going on there. We'll get into that in a little bit. But our goal was to get meaningful, usable data turned around quickly into benchmarking format so that you guys can use it to make your operations more efficient, to help control your costs, your staffing levels, etc., and be able to compare yourself to your peers either regionally or around the country. And so what you see in front of you is sort of a demo portal that we've got set up. And we're going to get into the datalynx tool itself and really show you what the result through all of this is in a process of getting rid of that manual lookup, going through those books. The ability to really benchmark yourself against your peers is almost instantaneous. And the data sets, most importantly, are updated on a nightly basis. So every time somebody comes in and fills out a survey, or a new member joins and fills out a survey, benchmarks get adjusted on a nightly basis as we integrate all of that data. So what you get is a more meaningful sort of real-time feedback on what's going on in the marketplace, both nationally and in the various AHRA regions. So that's kind of our introduction. I'm going to hand this over to Amy real quick. We're going to go through some of the basics on how to get into the surveys, what we're looking for in the surveys, some basic instructions and common errors that we run into, and then we'll dig in a little bit more to the datalynx product itself and show you what that all looks like. Amy's our data engineer. She's been really the woman in charge of putting a lot of what you're going to see in front of you together, intimately involved in the design and the integration of the data, and so there's really nobody better to show you how to use some of this than Amy. It's all yours.
All right, thanks, Bryce. First of all, I'll just show you how to access datalynx, both the survey and the datalynx tool itself, the dashboarding tool with all the benchmarks included. Everything is accessible to the AHRA website. It's a single sign-on. So through AHRA, you can find the datalynx page, and you can see there are two links. One takes you to the survey, and the other one takes you to datalynx. So the first piece of the process, obviously, is to complete your survey data. So here, when you click on the link, this is the landing page that you will be directed to for the survey process. There's an introduction page, facility, which is the denominator for all of the surveys itself and must be completed first. The productivity and utilization and the comp and benefits, those two surveys everybody should be pretty familiar with. And then there are 4 additional surveys that were added: equipment, radiologists and turnaround time, financials, and referring physicians. So there are a few things that I just want to point out on the introduction page. There are some definitions. If you scroll down to the lower section of the page, definitions, full-time equivalent FTEs, vacancy rates, and formulas. Just take a look at those before you complete the survey, and then also there are some instructions on this page. There is also a place to indicate if this is not your facility. The Region's Health Resources, you belong to that facility, but obviously if we did not, we would check no, and then put in your new facility information, and AHRA would then update your facility information. But at that point, if you do check no, don't complete the survey, wait for that information to be updated, and then your survey results will be associated with the correct facility. Another thing that I want to point out while we're talking about facilities is if you have multiple facilities, this survey is supposed to be submitted for each facility. So it's a single facility survey process. So if you have multiple facilities, contact AHRA and they will add those facilities to your profile. And again, for them to update that information before you complete the survey process.
I'll jump in real quick. It's really critical that you guys understand from the multiple facility piece, and also making sure that we have the right facility. This data is all intended for the membership, and the aggregate benchmarking that will get fed back is all about making the operational metrics available to everybody. And so if we can't accurately represent the right number of facilities and the volume and the cost and the staffing levels associated with each one, what we end up getting back from an aggregated data set ends up being not as useful and not as meaningful because we're not looking at individual results. So again, if you are the manager of 5 hospitals or facilities, or you're a manager of 10 or what have you, please stop before filling it out in one aggregate total, because that makes it less meaningful for everybody else. We really are interested in looking at what each of the individual locations is doing. And that turnaround should only take about 24 hours for AHRA to get updated once they're notified that there needs to be a change. So it just gives us all the ability to make sure that the data and the data integrity is maintained throughout this process.
So the first section that must be completed, as I had mentioned before, everybody has to complete the facility section because it is the denominator to complete all the metrics associated with the other surveys. The other thing I want to point out is that each time you click next, the survey data is saved, and you can come back to it at any time. Logging back in through the AHRA website, it takes you back to your survey. You can append your answers. You can complete surveys that haven't been completed. So you do not have to do this all in one sitting. Obviously, that would be a little overwhelming with this number of surveys and this number of questions. So you can come back. You can exit and come back. The other few things that I want to point out are there are some visual cues throughout the survey process. For instance, in referring physician, I'll scroll down. There are the hours, minutes. Those are throughout the survey. There are some places, obviously, where you are limited on what you can enter into the survey, but there are other places where there's just a format that you are encouraged to enter the data in that format, or else the data would not be integrated properly. So that's one example. The other example that I've seen some of is the definition of FTEs. It's the standard definition, full-time equivalent. The other example of some other common errors has to do with the comp and benefits and people entering zeros or ones. And I'll just flip over to the AHRA datalynx tool and show you an example of what that actually does. The data set. You enter zeros or ones. Wait 1 second because this is loading is live. If you look at the percentiles, the question was regarding annual salary. 75th percentile, that looks pretty accurate. That looks reasonable, right? 50 percentile looks reasonable, but then we get down to the 25th percentile, and it's $26.50 for 25 hours. an annual salary, and we all know that that's not really reasonable. So if you do not want to enter that information, just leave it. I guess that's the one piece of advice that I could.
And one thing we should point out, and although Amy has said, you can leave it blank, we obviously prefer that you don't leave it blank, because again, the more data we get, the more meaningful it is for everybody. But everybody needs to keep in mind as you go through and are looking at this, if you see those little cues that she was showing you with hours and minutes or FTEs or decimals or not decimals, that kind of thing, this data is all integrated on a nightly basis by a set of scripts that are run. So we have no manual editing process where we're able to try to catch these corrections. So if you put in something that doesn't kind of fit, when the data integrates, it's going to kick out responses that just don't make a lot of sense. And so while we are able to run through and take a look at exception reports, at a later time in the data set, it's much easier and a much more productive process if you guys can pay special attention to places where it's notifying you that certain answers have to be in a certain format. Just remember that this is all integrated kind of on an automatic electronic process, not through manual editing on anybody on our behalf.
Correct. As far as the privacy of your information, your facility information is only viewable to you. It's not viewable to anybody else. The most detailed level that the aggregated tools can be shown in is the AHRA region level specific areas. So it does not go to even to the state level. It just goes to the region level.
And the only thing ever, even within the data set in our databases, the only thing that is even identifiable is actually your AHRA membership number. They keep track of what facility you're associated with. So when you look at a survey and it says, is this your facility or not, that's all maintained at AHRA's level. That's not maintained on our level or within the datalynx database itself. So all there is a membership ID number. There's nothing that necessarily identifies your hospital or your radiology center or what have you. Nothing that we ask for contains protected health information. We're not looking for anything patient-level access. We're not looking for specific referring physician names or offices. So we heard some feedback in the initial planning phases about, well, we don't want to give up information about our referring physicians. We're not asking for that. Nobody's asking you to divulge who your referring docs are. We're looking for much more aggregated overall data sets so that we can get some trends and themes that are going on in the marketplace. So rest assured there is no sharing of data amongst facilities or any protected information that you would have to be concerned with in the data sets themselves.
So once you've completed your survey, then you would move on to the datalynx tool itself, again, accessible only through the AHRA website. So after you've completed your survey, you then have access to the 2006, well, actually everybody at this point has access to the 2006 and 2009 data that is on datalynx. But also, you get the summary reports, and I'm just going to show you a sample of one at this point, that is for your facility. It's based on your information that you've entered in. You get graphical and tabular formats for every survey section. It's something that you can print out and take to an executive meeting. You can give it to a new employee, for example, for the comp and benefits section, or the equipment section if you want to orient them as to what types of equipment. There's just various uses for this type of information, and it'll all be located in one location on the datalynx website.
The idea here was to be able to give you back access to, we know that you're going to be spending time completing these surveys and putting in a lot of information, and we felt it was important to be able to give that back to the membership so that once it's entered in, you now have access to that on a as Amy mentioned, in one location, easily accessible, and in a format that makes sense to actually read through and use for your own operations. And Amy touched on one thing, that access to the 06 and the 09 data is available now. As part of this process with AHRA, we felt it important to bring in the 06 and the 09 data sets from the surveys that were completed then, to be able to show the difference in what we can do now with access to this versus what you had access to is having to pull up a book and flip to a certain page and look for a certain metric, et cetera. So everybody, through your existing AHRA membership, can go in, click on the datalynx tool, it'll take you into this page, and you have access to the 06 survey results and the 09 survey results in graphical format that Amy's going to be showing now, and we'll walk you through, that mimics what would be, and we'll get into the levels in a little bit, but mimics what would basically be level 3 access to the new data sets that are being completed. So feel free to click in and play around and take a look at what's out there, get excited about using it, learn where the different pages and the results are and what you'd be looking at. Obviously, only the productivity and utilization and the comp and benefits surveys are there. The other ones weren't completed historically, so there's no data sets to those for 06 and 09. But at least for the 2 that are up there, feel free to dig around a little bit and see what you guys think.
So here's an example of the facility profile, which was typically included in the printed survey versions. This is just a graphical format, and as Bryce mentioned, level 2 and level 3, you would all have access to this for the new data, but right now everybody has access to the 2009. So this is a typical page. It's clickable. You can look at it by different types of facilities. You can enter up to 5 as it pulls the data set. There are other reports and graphs in the data set. And also, there are things that are exportable to PDF and Excel. You can download it and manipulate some of the data yourself, or you can take a PDF of a particular data point or benchmark for your own purposes as far as a meeting or internal.
This is basically a menu-driven, clickable, for all intents, web page is what you guys are probably used to seeing all over the place. Most of what you see on here is clickable in some format or another. It is, however, something we want to point out, and another thing that's been brought up through the testing process is there can be delays sometimes in loading some of these pages. Be patient with the process. Remember that these are not static web pages that are just bringing up static text. These are actually tapping into a live and real data set. So every time you click on a new report or you change a filter that you're looking at, this tool is actually running through an analytics process and pulling up the requisite information to display it in a certain format. So there may be a 4, 5, 6 second delay sometimes in pulling some of these up. Again, I know we expect instant gratification sometimes when we're going through web pages, but be patient on some of this. Just remember there's a large data set behind it that's feeding all of this information.
And as we had mentioned, there were a couple different levels, and I'm going to go through a couple examples to just keep that in your as we move forward. This is a level 2 page, which is meant to be tabular, which would be more like the book that you've received in the past. So we'll look at volume per tech, FTE by region and facility. The report is this. You can see that this is for CT, it's by a tech, it's for all regions, and the facility setting, you could change that to rural. We want to just look at rural, and then the percentiles that you're accustomed to are displayed, and this is exportable to PDF, and we can look at it for a different modality. Again, it updates the data. So this is the typical level 2 meant to replace the book display.
What you'll notice on this, everybody, is if you look at the middle section of those filters on the left, that's for all of the other positions that would have been reported on in this particular, in the productivity and utilization survey. As a level 2 access, those other fields are not clickable and not displayable. And again, it's intended to sort of stratify a little bit of what you're looking at. This is intended specifically to be a replacement for the book. And a lot of the detail that was asked for and is going to be reported on wasn't available in the book previously. And so that's why the level 2 is only showing you the technologist levels. You can do it by modality, you can do it by region, or in this case by center designation, but you wouldn't be able to change positions. When we get into, and Amy in a second will show you the level 3 reports and what that looks like, that gray box will go away and you'll be able to select individual positions and see what the reported information was on those as well. So it's just sort of a bit of a stratification in what you get for the different levels.
So here's the same information, but in the level 3 format. You can see there are many more filters over here. They're all combined in one location. So you can better define a peer group. But this graph displays the same information. It's just every participant and then the percentiles. Again, exportable to PDF or Excel. So if we want to look at it by different job position, so you want to look at it by tech aid instead of tech. Again, it updates, it gives you the number of respondents. So it's just a more graphical and more detailed way of looking at the data.
One of the things to keep in mind on the level 3, again, to sort of stratify and make this more usable, more meaningful for the membership, the other thing that the level 3 access does, and in this case it's not applying because we're logged in as Regents and Regents doesn't have any utilization data officially to report, but if we did and we were one of these facilities, my graphical data would show up in a different highlighted color. That bar that Amy's highlighting, for instance, would show up as a dark navy blue or a red or a different color within that data set. So I don't even have to go back and look at what did I say my number was, and I don't remember what my volume per FTE was, because my data is going to show up highlighted. In every one of these cases, as you're clicking around and looking and playing with the demo that's out there now, any place where you were given an answer, your answer set is going to show up, and it may show up as I answered yes or no. You know, my response was yes if it was a yes/no question, or it may show up. I think Amy's going to show. But basically, it's going to tell you, so that in the middle of that donut 2 years ago was how I responded, in theory, to that question. The last compensation increase was offered 2 years ago for me. But I can see what the results were for everybody else. Again, your basis for compensation increase, those are the things we answered. We answered it was based on organizational performance and personal performance review. But we can compare it. So I don't have to go and look up what it was I responded to. It just displays automatically on the graph for me. Again, we wanted to make it more usable, more meaningful, and a quick repository of data and information for all the membership to manage some of their operations and look at some of these benchmarks and metrics. One of the other things that I think that this is going to be really meaningful for is as we start talking about trends and what's going on within the industry. You know, Regents is a medical imaging consulting company. That's all we do. And so, you know, we're in it and sort of neck deep in it on a daily basis, and we get to see what's happening with our clients year over year and are able to pull together sort of our own trending based on what we see happening in various markets. Well, we're going to be able to feed some of that right back to you guys based on the responses that are given through all of these surveys. And so right now, we're just asking for calendar year 2011 data. Next year, we'll be asking for calendar year 2012 and so on and so forth. As we get more and more data sets completed year over year, there's actually going to be a trending tab to all of this. So you'll be able to click on a trending tab and look at all of these high-level aggregate benchmarks to see what's really been going on year over year and how does my facility compare to that. Is my volume per FTE going up or down? And what is the trend saying? Is staff becoming more efficient or less efficient? Currently, what you can do, and we weren't able to do an exact tie-in historically because with the 2009 data, we didn't have individual responses. We were just putting in aggregated data. But you can click back and forth between 2009 and 2012 as it sits now to see what's going on. So think about what's happening in the market for most people out there, which is reimbursements going down, costs are getting higher, everybody's worried about regulatory changes, et cetera. So our expectation would be, we expect people to be becoming more efficient. We're consulting people to try to find out how to become more efficient and to do more with less. So can your staff be cross-trained? Can they plug more patients onto a table in a quicker amount of time and get more volume through? Because the more volume you get through, the more efficient you are. So we look at 2012, and I'm just going to pick the blue box that shows our average. This is MRI, technologist, volume per FTE. We have an average of 1,153 scans per FTE. Okay, reasonable number. Let's see what 09 was. Well, Amy's going to pick MRI. We're going to go back into 2009. 2009, we were doing 1,529 scans per FTE. Exactly the opposite of what I would have expected to see, which is that hospitals and facilities are getting more efficient. It appears that we're actually becoming less efficient. Is that a result of volume decreases? Maybe. Is it a result of just how the data was reported as a result of the number of respondents? It could be. In this case, we had 218 respondents from 09. In 2012, I think that number was 80 respondents. So we don't obviously have as complete a data set as we had 3 years ago. But that's a trend that I would be a little bit concerned with on a national basis. And so this gives you the ability to click back and forth between what was reported in 09 and what's showing up on the data sets now to see what is the market doing and what do the trends look like. What is my facility doing? Am I keeping up with or am I falling behind? And it gives you sort of a bit of a performance metric to say, look, the market's getting less efficient and I'm getting more efficient, so I must be doing okay. Or conversely, I'm doing worse than that. My decline has been even more than the, whatever that number is, the 20%, 50% decline there. I'm even less efficient and I need to start looking at my staffing model or my volume and my marketing or what have you. So just a nice way to be able to click back and forth and look at some of the trends year over year. Just another quick one we can look at is just the services and technology. This is just a quick little report that shows who responded and what services are offered at each of the facilities: general radiography, ultrasound, CT, MRI. And we'll pick MRI again. In 2009, it looked like 85.3% of all of the respondents had MRI services. In 2012, we'll look at basically the same data set, and we have 85.5% offering MRI services. It's about what you would expect. We wouldn't expect MRI to have huge leaps or huge declines. The next time we ask this question, we may have PET MRI as a selection, and we can start looking at the increases in usage of PET MRI and the facilities that are putting it in. Or you can look at each modality and say maybe some of these really are dropping off and try to dig into what might be causing increased use or decreased use of certain modalities at various settings. So again, just a way to look at some of the trends and show you some of what you can do with this tool once all these data sets have gone live and everybody has access to them, which is kind of a side note but an important one, and that is that we're launching this officially at the annual meeting next week, and the data, the live data, the full access to the 2012 results will be available on September 1st. So a couple more weeks and you guys will be able to dig into this full steam ahead, so to speak.
Anybody have any questions at this point? Nobody?
No?
No one?
You guys still awake? Have we bored you all? All right. Somebody's still there, just making sure.
Yeah.
We go through this quickly. We're excited about it. We hope you guys will be excited about it because it really is kind of a revolutionary way of looking at some of this data and aggregating it all for everybody. So we hope that you guys find it as useful as we think you will, particularly in looking at your individual data sets, looking at the aggregate, and then looking at some of the trends. So we're going to go ahead and talk about some of the pricing and the level differences here. This is on the AHRA website as well, so you guys can go and study it and look at it a little bit. But want to point it all out for you all, and then we're going to show you a really quick public access demo that you guys can request info for or request access to that shows a little bit of what National Imaging Network is doing. I'll touch on that in 1 second. But the level 1 access is basically free for everybody. We encourage you, you can log in now and look at the 06 and the 09 data.
Good.
Free, have at it, take a look. But this also gives you access to those individual facility summary reports that Amy showed you just a few minutes ago. Once you complete a survey and you put your data set in, you'll have access to those reports that you have executive level summaries to say, here's what all of my responses were, a nice graphical format in places where it's appropriate, that sort of thing. We want to encourage as much participation as we can. Again, I can't stress enough, this data is only as useful and valid as the members who are willing to put their data sets in. It is really meaningful stuff as long as we can get accurate, reasonable data from as large a member source as possible. Level 2 access is sort of the basic book replacement as we talked about. It's $250 for AHRA members who have participated in completing the various surveys. So that $250 is a discount of $500 from the normal non-AHRA pricing. Normally we would charge $750 for that level of access. The $500 discount applies to any survey that you have taken the time to complete. Again, we encourage participation. It gives you a discount on what you're looking at. And so if you only complete the comp and benefits and the productivity and utilization, the $250 will give you that level access to those two. If you want access to the other ones but don't want to complete it, then it's $750. That is not a charge per survey. I want to be clear on that. That's a one-time access level for as many of the surveys as you either complete, or in the case if you don't complete them, it would be $750 and you could get access to all of them. And that is for the tabular level, looking at percentiles and the limited filterability of some of those peer group filters that Amy was showing you.
There are also some graphical formats, just limited graphical formats. As far as the geographic distribution, those will be graphical as well.
So level 3 access, which is really where your most bang for your buck is, and hopefully you guys have seen how useful and meaningful some of that can be. For non-members, so if it was Regents, although technically Regents is a member, but we don't do surveys. So for non-members or a GE or a Siemens or, you know, a Zotec billing company or anybody else who might want to get access to this, the non-member cost for the level 3 access is $22.35, and that would give you full access to all of that identifiable, filterable information. The discount off of that is almost $1,500 if you are an AHRA member and you complete these surveys. Really want to encourage participation. I can't say it enough. So for $745, if you complete the surveys, or as many of those surveys as you do complete, you would get full use of level 3 access with your data set identified, filterable by all of those peer groups, et cetera, graphical formats, everything else that we've showed you that comes with that extended access. So that's really where your most bang for your buck is. The other thing that's important to remember on these is that it is a rolling 12-month membership, basically. It's a 12-month access to these data sets. So AHRA will be tracking when you purchase it, and a year from then, you'd then be able to buy it again and get the next 12 months. The important part of that is, let's say you buy this data set in December, for instance. I don't know why you'd want to wait that long, but maybe you do. So you buy it in December, and in April and May of next year, we start rolling out the surveys for 2013, and in July, August of next year, the 2013 data becomes available. You would have access to whatever the most current level of material is. So you would continue to have access to the 2012 surveys, and you would gain access to the 2013 surveys up until the point where your membership expires or that access expires a year from your purchase date. Yeah. So it's a rolling 12 months from when you buy access, and you would get access to the then current level, any prior years that are in there, and whatever the most current level is if data gets updated during that time period. The other thing to point out, and we should have done it a little bit earlier, is all of this data is updated nightly. So as more members come in, the data set may change. So your 75th percentile may go from 1,500 to 1,400 or to 2,000 or whatever it is on a nightly or weekly basis as more members come in and complete more data. Again, it's a live data set that this is polling and calculating. But every time you look at a report, it'll tell you at the top, data as of. So we're looking at it as of August 9th, Thursday, August 9th, 2012. So that's when the last integration was done. Just want to keep that in mind. Lastly, I'm going to get into a really quick discussion about National Imaging Network, which is really who partnered with AHRA in doing this. National Imaging Network is an imaging collaboration where we are trying to bring radiology providers, hospital-based, physician-based, radiology-based, outpatient, into a sharing of benchmarks and services and best practices that would include bringing in best practice gold member vendors that we've vetted for various services to try to kind of raise all ships. We're trying to make everybody more efficient with less involvement. We're trying to make it so you don't have to use IT to spend a lot of time pulling reports and providing operational metrics back to you in a dashboard, usable information that as a manager of your facility you would want access to on a daily basis. So I don't need to pull a report that's a month or 2 months old. I can pull a report that shows me what happened yesterday. So this is a public demo that you can request access to. Just give us a call or go to our website, nationalimagingnetwork.com or regentshealth.com. You guys can ask for access to this. And I'll get to the pricing on it in a second, but this dashboard is your overall operational dashboard, and you can see there's access, efficiency, utilization, and all of this, again, these are live data sets that these numbers are pulling from. We've anonymized the data so it's not any one particular client, and again, data integrity and security is the utmost importance to us, so nothing ever gets mixed and nothing's identifiable to anybody else. This is all, and it's a HIPAA-compliant server, and again, we're not publishing back any protected health information. We never commingle the data sets from two different clients. That's all kept in what we call sort of separate sandboxes, so you don't have to worry about your data and somebody else's data being mixed and matched. But this is all a look at what is my efficiency, expenses versus budget? What is my contribution margin? What's my exam time in minutes? That's current. That 14 minutes is my average exam time, right? I can look at my average patient waiting time, which is 10 minutes right now. So as a manager, I can look at this dashboard and see, are there places where something's in the red and I need to go figure out what's going on and what's going on right now. There's also other dashboards. There's a market share dashboard, for instance, which we would upload your utilization data on a CPT level basis, on a zip code basis, to be able to give you a live look into what is your approximate market share for any given modality. So I can look at, do I need to put in an urgent care center here because I know that we can, do a bunch of CT and X-ray at this urgent care center, or do I need an imaging center out here to address the outpatient market? And I can look at market share on a zip code and county basis by modality. We have a referring physician dashboard that allows you to track not just volume coming from a referring physician, but the payer mix and the collections of the patients that are coming from a referring physician. So you can look at who are my most productive and which physicians are contributing the most to my bottom line as far as the patients that they're sending. I can look at, referrals by subspecialty. I can look at combinations of diagnosis code related to procedural code that's being done, so we can see if there's any relation between the diagnosis and the exams being performed and what's coming out of that. There's a referring physician scorecard, and this would show you, based on an individual referring physician, once this loads up again, remember this is a live data set, based on an individual physician, I can look at what are the loyalty index over the last 6 months. Have they sent within the last 6 months, within the last 3 months, within the last 1 month, and I can see, green, red, yellow, based on how many referrals they've sent and that sort of thing. So it's a whole new way of looking at referral tracking. All of this stuff is accessible, and there's a couple of different ways of doing it. Our standard pricing for AHRA members on integration with National Imaging Network is $16.95 per month per site. That also involves an implementation process where we can tie into your data sources directly. So there's no need to run reports. There's no need to deal with complicated HL7 interfaces. We literally set up scripts that can talk to your PAC system, your RIS system, your billing system, your phone system, your time clock system if you want to, any number of systems that we can tap into and get automatic feeds from those systems, and it removes the human element so that we know that the data that's reporting back to you is accurate and coming straight from your sources. We are also in the process of rolling out, for people that the $16.95 is a little bit much to chew on a monthly basis per site, we're going to be rolling out some modularized access where you can buy just specific modules of referring physician only or efficiency only or financial only, and where rather than dealing with a direct data connection because perhaps your data security folks are uncomfortable with that, we can just run through doing a data export, and you could feed an FTP site and we can still integrate it on a nightly basis or every 6 hours or every 12 hours, however often you want that data updated. It will be based on a data feed that you provide. So those are some things we're doing from in partnership with National Imaging Network is really getting rolling now. We're very excited about it. We hope you guys will be too, but obviously datalynx is really the sort of gold standard now for data reporting, benchmarking, survey results. And we encourage all of you to come take a look, dive into the demo. Come see us down at the annual meeting. We'll be at booth 715. We'll also have a presence at the AHRA booth itself, so as you guys register and walk in, ask the AHRA volunteers there. They're going to be there to answer questions and go through this process as well. We really encourage as much participation as we can and look forward to chatting with all of you when you get a chance. So that's the gist of our sort of demo and presentation. Are there any questions we can answer for anybody? Or you guys have any curiosity about anything we've talked about, or?
I have some questions, but I think it's a conversation to have offline.
Okay.
With someone, so I can contact you by email, or.
You can get to me via email. My email address, I'll give it to everybody so you have it, is my first initial R, last name ERIM as in Matthew, at regentshealth.com. You also can call. We've got an 800 number that should be on the splash screen in front of you. It's 800-423-4935, and you can ask for really anybody in the office here. We're all pretty up to date on this, but ask for Rife. Be happy to talk through any of these questions with you. By all means, contact me directly. Be happy to discuss it. Anybody on the line actually completed their surveys? Come on, I know you all have, right? Okay, is everybody going to complete them by this weekend?
No.
was worth a shot. I should also point out, and
I was waiting to see the value. I mean, not knowing what value this was going to add for me personally, and I have 5 acute care hospitals and 6 outpatient imaging centers. It's a piece of work.
It is definitely a piece of work, and I can certainly understand your hesitation. Hopefully, we have demonstrated some of the value. And again, be happy to have a more detailed discussion offline about how this process works, and if there's anything we can do to kind of assist in some of that, we can certainly do so. But there is, we believe, a tremendous value in the end result of this, understanding it's a lot to ask, but also keep in mind that you can do these a piece at a time, too. So you don't need to be overburdened with trying to complete 7 surveys for all 6 locations all at the same time, because that would certainly probably be a little counterproductive in your own efficiency. But to the extent that you can do one at a time, et cetera, you certainly have that ability as well. So there's also I think it's on the pricing page on AHRA. There are actually some sort of small incentives that we're encouraging people to sign up for, and that will be used to encourage participation and purchase of the different levels. So keep in mind that there's a few giveaways that we're encouraging the first however many people to sign up. So if that's important to anybody, take a look. And again, hopefully we can see all of you down at the annual conference. Again, we'll be at booth 715 down there. So looking forward to getting down to Orlando this weekend. All right, anything else? If not, we'll sign off, but feel free to give us a shout at your convenience, and look forward to seeing everybody.